Depending on how much experience the person has, just the frame of reference for how immunotherapy works mechanistically, clinically, really sometimes takes a little bit of a learning curve. So certainly on the clinical evaluation in terms of efficacy standpoint, understanding that sometimes we see this phenomenon of pseudoprogression or delayed response is important to understand. It's a relatively rare phenomenon. In melanoma, it's been reported as about 10 to 15% of patients with both ipilimumab as well as with PD-1 blocking antibodies. So, but the long and short of it with that is treat the patient. In other words, when the patient comes in, if they're feeling well and there is no evidence of biochemical decline, like their albumin's still high, but the scan says there's progression, you need to consider the idea that that could be an initial sort of uptick before you're going to see response. Now, in the same vein, we don't want the idea to be out there that all patients on immunotherapy should get 2 scans. If a patient comes in and is declining and the scan shows progression, the patient's progressed. And there's no need to do a second scan before you go on to a subsequent line of therapy. And that's an important point to take home because there is some concern that some patients might be treated too long with immunotherapy. The other side of immunotherapy that's different is really the toxicity evaluation. So we're used to chemotherapy like side effects, nausea, hair loss, fatigue, etc. That's not really what we see with immunotherapy, but rather we see autoimmune-like or rheumatological effects. So you can see a rash most commonly or a dermatitis, but the things we worry about the most can be colitis or diarrhea, shortness of breath, which is a pneumonitis, which has been reported as being fatal in rarer patients, as well as endocrinological problems like thyroiditis and hypophysitis. And so it's a new spectrum of things, and it harkens back to our training as internal medicine doctors. It's time to get that internal medicine hat and put it back on. Realize that if a patient is complaining of something, even if it's unusual, really need to dig into that more to make sure that that's not an immune-related problem secondary to the immunotherapy.